What is proper sitting posture, and does it differ from body to body? I get this question all the time in the clinic, and so many people are wondering, how do I find the proper posture for my body? So today we're going to discuss that, as well as how it might be different than other people's. I'm Dr. Amy Konvalin, and I have a PhD in orthopedic manual physical therapy. I am empowering women with aging bodies to be able to move like they're 25. Again. And so many people are confused about what proper posture is and what they should be doing on a daily basis. Because they've already been to a physical therapist, they've already tried different exercises or stretches, and they may have even tried using those posture correction tools. Now, those posture correction tools can be super helpful in that they can help you know when you're getting out of the correct posture, particularly if you sit for prolonged periods of time, like for work on a computer. And I'll include a link to one of my favorites in the description below. However, there's still the matter of being able to find that correct posture and make sure that your body can get there. You see, there are so many people who their body is stiff or tight, and they're not capable of actually getting in the correct position in the first place. So you may need to do some stretches or some exercises regularly in order to help you achieve the correct posture in the first place. And I'll link a video here to the exercises that I recommend, especially for people who sit at a computer all day long. Now, realizing that you may have some structural issues that keep you from attaining the correct posture for you, or what some people would term that perfect posture. You see, some people actually have bony changes that have occurred over time, and then they try to do these exercises that are guaranteed to get them into the proper posture, but your bones literally may not move that way. And this is really an important note, because your bones change over time, all of your bones, based on how the muscles are pulling on them, how gravity is pushing down on them, how you're interacting with the ground. Your bones are constantly changing and adapting. Now, they don't do it fast, they do it slow over time. However, if you have been in a kyphotic posture, let's say, so a forward bent posture for long periods of time, for years and years and years, you actually may have some changes in your vertebral structure, which may not allow you to attain that perfect posture that you're trying to obtain. So if you've watched a ton of videos and you tried a bunch of stretches and exercises and you're like, I still can't get to the point that they're talking about, then this video will be for you, because we're going to discuss the perfect posture for your body and what you should notice along the way, as well as give you some ideas and some direction on where you should go if you're not able to obtain that posture. And perhaps most importantly, I'm going to show you how to find your perfect posture on your own. You can even do it at home without any special equipment while you're sitting here and watching this video. Let's describe what we're looking for with perfect posture, because again, it's different for everybody. What we want is where your head is resting on top of your shoulders are resting on top of your hips, your feet are equally on the ground. Now, if you have to sit for long periods of time, like at a computer for work, then I always encourage people to be in a chair where their hips are slightly higher than their knees. Now, I know this goes against common advice because many people have been told that their hips need to be bent to a 90-degree angle. So let me explain. When your hips are sitting slightly higher than your knees, it helps your pelvis, which is your ilium, those big hip bones on each side, and then your sacrum, that heart-shaped bone in the middle. It helps your pelvis to be able to actually tilt a little bit forward. Now, when your pelvis is tilted a little bit forward, it makes it a little bit easier to stack your spine up correctly and have that head on top of the shoulders. Now, I'm not saying that this is impossible to achieve if your hips are bent to 90 degrees. It just requires a little bit more work and may require a little bit more support. So if possible, bring your chair up a little bit, have your hips a little bit higher than your knees. Then that will help that pelvis to tilt anteriorly and just make this whole exercise easier for you. Now, once your pelvis is in the correct position, you should feel that spine stacking up right on top of it. The goal is that this feels like an easy position to maintain. You don't feel like you're having to work too hard. Now, due to muscle imbalances or other issues in your body, if you feel like you have a lot of strain when you're in this position, then I recommend using a small pillow or a towel roll propped behind your low back to help you maintain this position with more ease. For you, you may find that once you get in that spine in that correct position, then the shoulders and head follow suit. However, for some people, their shoulders still want to go down here, and it's hard to get everything stacked up. In that case, I recommend just doing a little bit of a shoulder roll, so bringing those shoulders up and back, trying to tuck those shoulder blades into the opposite pocket. So the right shoulder blade will go into the left back pocket, and the left shoulder blade will go into the right back pocket. That will help to get your shoulders on top of your hips, which will help to align that spine. Now, where should your head be? Your head should be directly on top of your shoulders. And you want to make sure that when you're in that position, your chin's not having to jut up, and also that it's not too far down. Either way can cause a lot of neck pain over time. So we want to make sure that that chin is just pointed forward, nose is pointed forward, eyes are pointed forward. Now, side note here, if you do work at a computer for a long period of time, when you're setting up that monitor, this is where you want to set that mid-monitor height right at that eye level. This will allow for small motions of your eyes and neck while you're looking up and down to be able to read the monitor, but it won't cause anything too crazy or anything that causes too much strain. Okay. So now your neck is on top of your shoulders are on top of your hips are slightly higher than your knees, and your feet are planted on the ground. When you're in this position, it should feel like a position of ease. You should not feel like you're having to work very hard. And this is one of the things that I really see a lot in the clinic, is that people are trying to keep this like military posture. So they're really trying to sit up nice and tall, and they've got this really straight spine. Your spine actually has some natural curvature in it. In your low back, you have a curve that goes a little bit in. In your upper back, you have a curve that goes a little bit out. And then your neck is actually supposed to have a little bit of a curve that also goes in. This is what we term normal spinal alignment. And this is what I was talking about earlier, where it may be difficult for you to be able to get to this position because the shape of your vertebrae may have actually changed. So when you're in this neutral position for you, there shouldn't be any pain. Obviously, if there's pain, you need to address that because that's going to become a problem over time. Your proper posture position should be very comfortable. It should feel very easy. You can use some towels or some pillows to support it, but you shouldn't have to feel like you're working really, really hard. So I promised you I would show you how to get in this position on your own right now. So you want to start by sitting on a firm surface. You're going to put your hands on your knees just because it helps to give you a little bit of leverage. I find that it makes the exercise a little bit easier. You're going to lean back and you're going to go ahead and put your head down as far as you can. Now, obviously, this is not ideal posture, friends. So now you're going to find that opposite position. So you're going to roll on up and you're going to go into that extended position. So really trying to military posture, get up as high as you can. As you roll between that forward bent position and that really extended position, you should find a position in the middle. And I usually find it when I'm rolling up. I can't really find it when I'm rolling down. But when I'm rolling up, where now I feel like my head's on top of my shoulders and my shoulders are on top of my hips. This position feels like one that would be easy to maintain for 20 to 30 minutes. So you can try that at home, just gentle movement. And again, that movement shouldn't be painful either. If that movement's painful, then there may be another issue going on that needs to be addressed. But that movement should feel pain-free as you go from one extreme range of motion to the other extreme range of motion and find your position of comfort in the middle. But again, that position should be pain-free when you get there. Now, most people that I work with, when they struggle to get into this normal position, and especially having their head on top of their shoulders, it's often because they do not have the mobility in the upper back or the motion in the upper back in order to be able to find this correct position. And what ends up happening is that their upper back is relatively straight, and that causes a straightening of the curve in the neck, which causes that head to come forward. When you are in that forward head posture, those muscles on the back of your neck have to work really, really hard to try to hold that head up on top of your shoulders. And that's where you see a lot of neck strain. So if you struggle with neck strain after you've been sitting for a prolonged period of time, especially if it's when you're at the computer or even watching TV, what I would recommend is having a friend or family member take a picture of you when you are in your ideal sitting posture and see what you notice. Is your head in front of your shoulders? Is your upper back either excessively straight or too bent? And what's going on with your low back? Does your low back have a little bit of a curve, or is it really straight? They say a picture's worth 1,000 words, and I can guarantee you it's true, because when I see patients in the clinic and actually see that the posture that they're able to get into, it really tells me a lot about what could be going on with them, as well as how the muscles are activating and controlling that motion. It is really important to make sure that you're maintaining proper posture throughout the day in order to decrease neck pain. That not only can the muscles get overactive because they're trying to hold the head on top of the shoulders, but it can actually cause damage to the joints. So if you have been told that you have arthritis in your neck, that is very common because gravity has been pushing down on your neck your whole entire life since you started walking. And if you're in that incorrect position for a long period of time, that forward head posture, that puts increased stress through the joints. And the joints don't like having increased stress. They respond by laying down bone. And that's what arthritis is. It's abnormal bony formation that has occurred within the joint. And so a lot of people get really frustrated because they start having this arthritis pain in their neck. Usually their muscles are super tight, and they're wondering what is it that they can do about it. And although there is treatment for arthritis that we're not going to discuss in this video today, the best treatment is always prevention. So making sure you stay in that correct posture regularly throughout the day. Now, you may be saying to yourself, well, my neck pain is actually coming from a disc problem. And the same thing applies. You see, discs need to have normal motion in order to get the nutrients required for healing and even maintenance. If you're in a forward head posture, there's no way for those discs to be able to get that nutritional source, because what's happening is you're shearing. So instead of doing normal rotation from side to side, which the discs actually really like, that's actually what brings in that nutrition for them, they get stuck in this sheared forward position. Now, even if you're in this position and you're trying to rotate, you're still not going to get the nutritional needs met of the disc because the position is not optimum. So if you're trying to heal a disc, or if you're just trying to maintain normal disc height, it's really important to make sure that that head is on top of the shoulder so that you don't have abnormal shearing through the disc. We do have to talk about the nerves because obviously there's tons of them coming out through the neck. So you actually have 8 cervical nerves that come out on each side of the cervical vertebrae. If you're in a forward bent position and you're having shearing of the disc and compression of the joints, that has the potential to put indirect or direct pressure on the nerves. The indirect pressure would be the inflammation bathing the nerve root as it's coming out from the spine, or it could be direct pressure that's actually caused by the shearing of the disc and the compression of the joints. Now, you would know this is you if you have sharp shooting pain that commonly will go down the shoulders and even into the hands. When things have gotten to this point where you're starting to have nerve problems, it becomes way more challenging because once those nerves are irritated, it becomes more difficult to calm them down. Unfortunately, that's usually when people will come ask for help. So My challenge to you, if you are watching this video and you do have nerve problems, the first thing I want you to work on is your posture. And if you cannot get into a correct posture without pain, then I'm going to encourage you to seek help from a manual physical therapist who can help you be able to move better. And if you do not yet have any nerve pain in your shoulders or your hands, then I'm definitely going to encourage you to work on your posture now, because trying to deal with nerve pain is really, really challenging, and we want you to get into the best posture for you early on, before there's any problems. You see, my big thing is I would rather help you figure out how to stay pain-free throughout your life than have you figure out how to get out of pain. It's way more difficult once you're stuck in that pain cycle. You start to have the joint involvement, the disc involvement, the nerve involvement, the fascia and the ligaments may get involved. It becomes a more difficult puzzle to undo. Whereas if you stay in a normal posture that is the ideal position for your body, you may avoid all those other problems in the long term.